Interesting Medical Facts Part 40. When we used to dose chemotherapy, there was a serious concern that if we had someone who was obese, if we gave the actual dose for their body weight, we'd be causing toxicity. But what we later found is that we were underdosing these people at a dramatic rate. So this essentially meant if you had a cancer that could have been curable with the right amount of chemotherapy or immunotherapy, there was a real chance that if you were obese, you might have had less of a chance of being cured, because the idea is, well, we're not used to giving this much chemo, and this might cause more lung toxicity, bladder toxicity, stomach toxicity, and so on. But the reality is, the real toxicity that we weren't taking care of was the actual cancer itself. Now, to be clear, with certain chemotherapies, it can find its way into the adipose tissue or the fatty tissue, and that in itself could be a danger for someone who is overweight or obese. But again, that was not the majority of chemotherapies or immunotherapies. And so these patients, thankfully now, it's in the American Society of Clinical Oncology's guidelines. If you have a patient who's overweight or obese, dose them appropriately. Give them the full dose based on their actual body weight.